Breakthrough cases of COVID-19 are rising with the Delta variant.
That's where a person gets infected despite being fully vaccinated. Let's bring in Dr. Michelle Udayamurthy from Kelsey-Seybold. Good morning. Thanks so much for joining us. Doctor, I want to go ahead and get this question out of the way first. If a person gets infected who has been fully vaccinated, that does not mean the vaccines didn't work, right?
That's correct. The vaccines are designed primarily to make sure that if you should get COVID, that it will be a much milder form and not a severe case.
Early on, when we just started hearing about this Delta variant, the CDC said breakthrough cases are very rare. But do you still think that's the case? Because it seems like everybody we know who got that vaccine is now having to deal with it. Do you find it becoming more common because of Delta?
I think it's a little bit more common because of Delta, but on a whole and on an average from especially what we're seeing in the clinic and at the hospital, the breakthrough cases are few and far between compared to unvaccinated individuals.
Does the CDC track the breakthrough cases if they're not hospitalized, or is it only if they're hospitalized they're going to track the breakthroughs?
I know for Houston especially, I can speak to that, is usually the health department is actually tracking the breakthrough cases. So when you do test positive, the Houston Health Department is tracking the breakthrough cases to see, if that individual was vaccinated or not.
Well, we certainly don't want to upset anybody or get them scared if they've got the vaccine because they thought they were feeling good about it. Let's talk about how that's working and keeping them out of the hospitals. We've been talking to hospitals all along, and they were saying it was only 1% to 5%, depending on the hospital, of vaccinated people who were in the hospital. So the vaccine was keeping them out of the hospital in the beginning from the Delta variant. Is that still the case at this point?
That is still the case at this point. The vaccinated individuals who are unfortunately getting COVID are actually staying at home, weathering their course at home. Maybe their symptoms are actually a little bit shorter in duration as well as compared to unvaccinated individuals. And what we're seeing in the hospital side is it's mostly unvaccinated patients that are actually getting admitted for, the lung problems and for being short of breath or hypoxic as well.
Let's talk about how contagious a vaccinated person with a breakthrough infection might be. Can someone who's fully vaccinated be asymptomatic and pass the virus to others?
So I believe we're still seeing, we're still doing research data about that. Let's say if you're vaccinated and you do get COVID, you're going to want to go ahead and quarantine for a full 10 days from the start of your symptoms, just so you reduce the chances of passing it around to anybody else. Even if your symptoms are gone.
Okay. And then we've also been hearing some concern from our viewers wondering about breakthrough cases. If they do lead to long COVID, do you think that could be a problem where someone can't shake their symptoms for months?
So the long haul symptoms are less in vaccinated individuals as compared to unvaccinated individuals. So really still your best bet at preventing long haul symptoms and COVID in general would be the vaccine.
Okay, Dr. Udayamurthy, great conversation this morning with you. We appreciate you joining us from Kelsey-Seybold. Take care.
You're welcome. Have a great day.